Is there any nutritional requirement for fluoride at all that you know about?
No, it's based on a faulty science.
For me, the purpose of it was to talk to a dentist who is actually someone who, now that you're not practicing in the UK, there's not a single dentist who is willing to make a public video to talk about the kind of thing I want to talk about with them. My own dentist included. You know, she would be too scared to talk about it, even though she has her private views, because of fear to lose her license, and she's a practicing dentist here. So that's why I wanted to talk to you about it. So why don't we just start now? Maris, can you please introduce yourself to everyone, please?
Okay, so I am a dentist, a holistic dentist. I've been trained and studied in Lithuania for 5 years and residency, so almost 6 years study to be a dentist with a license. Then I moved to UK, been working in NHS and private, worked in Harley Street and everything. And nowadays I'm a bit get tired of London and business in London, you know, the Brexit stuff. So I moved to Lithuania and now practicing in Lithuania. So I don't have any license in UK anymore, but I've spent nearly 13 years in, you know, dentistry. And I've seen everything, NHS, I've seen your private dentistry, I see, you know, the quick fixes, and I see, you know, the you know, real deep kind of treatments which, you know, really get into the problems with the patients. So I thought I see it all, you know, what's everyday dentist is kind of embraced all the challenges.
Right, fantastic. Well, it's great that you're talking to me about stuff, because specifically the first thing I wanted to ask you about is to do with the toxicity of fluoride, because fluoride is the substance that we focused on. It's part of the reason as a company we formed in the first place, to remove it from water, where
Okay.
it's where it's written into the Water Industry Act 1991. Many places throughout the UK have this added to water, and it's common to find on the high street toothpaste all with fluoride in them. So what is your understanding about generally about toxicity of fluoride?
So let's begin, you know, with the education. And, you know, in my education in Lithuania, in Kaunas Medical University, we had no clues of, you know, toxicity as I understand right now. I mean, there was a saying, you know, don't overuse it, don't swallow it and everything, but how it affects, why it's important, and, you know, why we should detoxify, you know, fluoride, excess fluoride, you know, none of these things were mentioned. I don't think, you know, it's really, you know, dentists in the UK as well, because it's just something, you know, like a taboo. And for many years, I didn't know much. It's just, you know, I've been exposed to the situations where I had to apply fluoride, you know, to children and, There was different programs promoted by government and NHS to fluoridate teeth and prevention. But nowadays, when I look at this, it's like working with the dangerous substances with the children, which these days are, more and more intoxicated with bombarded with all the chemical from, fast foods and, all the food industry. So I don't think that's a really wise thing, specifically that, the more you look into fluoridation efforts and how much people are exposed to fluoride, and we still have the pandemics of, caries and decay, I don't solving, or it's really paying a high price for little things it solves. So from my understanding, fluoride toxicity is really because of its nature. Fluoride is a very negatively charged halogen, and it really pulls the electron from other substances, and that's how it's one of the toxic elements, known to man. And when it gets into the body, there's a lot of antibiotics based on fluoride. There's a lot of antidepressants based on fluoride. The chemical formula, and these compounds, they really affect the body. And there's very little studies done on how it's had all these side effects. And there was always a topic, where's the study for CNS, for central nervous system, and how does it affect him. And unfortunately, there's no public study, or at least I don't know, which really covers the fluoride effect on the central nervous system. But the controversy doesn't end there, because if you really dig deeper, and that's where I really found out more about fluoride, there were some government programs in Manhattan Project in USA where they really saw the toxicity of fluoride, and they had to kind of deal with it, because it was the personnel, the military personnel was exposed to these substances, and they have to really find out. But all these studies and research is not in the public domain, so we just can speculate why. The studies were done, but they just not public for some reason.
So, like, why are other dentists not talking about this? Do you think?
Well, because they're being exercised, and I don't know why, but I never took it other opinions too seriously. It's just I was doing my research, I was doing my studies, and I seeing results. I know how to mineralize the body, how to detox the body from fluorides, and how to get the teeth stronger the other ways, and which work with more efficiency rate than the fluoride. So for me, it doesn't matter. But other dentists, because they were taught, that's the only one of the factors which really helps to keep the teeth strong, and we are taught is the fluoride. The nutrition fact is really minimal, gets minimal hours and minimal teaching in the school where I came from. I'm not sure about UK's educational system, but the fluoride is like a cornerstone about the prevention on dental caries. And once you start questioning this, it becomes a really difficult thing, and you're getting exercised by your peers, because everyone knows that fluoride is good. Why are you questioning this? This. Have you done any studies? Do you have anything to show? And because it's taboo, it's the system doesn't allow to get it questioned. There's no research done, and we get in this limbo situation where anyone who questions the status quo is exercised.
So have you seen that happen to other dentists who did do that in the UK, for example? Did you
Not
experience?
personally, but I know the cases where if you usually more of my what do you call it, communication in publicly is with the patients, with the clients, kind of talk to those people who listen. in professional bodies. There's a lot of people who have higher degrees, doctors and professors, so they are not in position to listen to something, and they just have their own opinions, and they're very strong about that, and anyone who challenges that, they they feel challenged, so they doesn't go pretty.
So, like, can I ask you also about the issue of like topical versus systemic use of fluoride, and about whether a small dosage is beneficial but too high is too much? I mean, can I get your view on that as well?
Yeah, so let's start with the dosages. With the dosages is like this, that we have what we get in the toothpaste, we can easily get overdosed with the just 3 grams of toothpaste. If you swallow 3 grams or more of toothpaste, you can start having the side effects of nausea, vomiting, cramps. That's the side effects intoxication of fluoride, and it's just 3 grams. I don't know how much you put on your toothpaste, or you don't
Well,
use.
in the TV commercials for toothpaste, they kind of put it over the whole length of the brush, and it's kind of like ice cream, and that's kind of like what a lot of people do. But how much fluoride in, say, normal Colgate toothpaste that you buy at the supermarket, when they brush their teeth twice a day like this, right? How much are you actually getting because of the into the bloodstream
So
through the
one thing,
gums?
how much you swallow. The other thing, how do you get through the gums? And if you think, that if you have a heart attack and you get nitroglyceride, into your cheek and under your tongue, all this chemical compound goes to your brain straight away. That's how you prevent your, heart attack. So the oral cavity is very useful in absorbing all these different nutrients and toxic materials. So I can just speculate how much does it enter. I don't think there's any studies done in that regard. I would say it's a lot.
Hmm. Yeah.
So well, me, I'm personally advocating no fluoride toothpaste. I haven't had fluoridated toothpaste for nearly about 8 to 9 years,
Hmm.
and never had a cavity since. So probably that worked for me.
Yeah, yeah, looks like it has. So, what do you think then about, say, water fluoridation programs in the UK and Ireland, as well as widespread use of fluoride toothpaste?
Well, first of all, it's based on a faulty science. And again, if we get back to the science and who actually were in the beginning of the dental fluorization, is the same guys who were involved with the military in USA. And if you dig deeper, you find out there's a lot of interest involved, because there was a situation where the USA was filed a lawsuit for them against the fluoride toxicity and damages to the neighboring people and farmers. And one of those doctors who actually were dealing with these lawsuits were the same who are recommending and educating about massive fluoridation. So I would say this is a conflict of interest, and there's people just need to study this. There's you can get very quick labeled as conspiracy man, but once you really connect the points, you see that there's some issues where U.S. government says it's classified as a national security issue, but once we get to the point that it affects all the people in fluorinated areas and all the children, with the effect of fluoride, I would say it's really important, to get educate yourself.
Mhm. And one thing about children as well, is it true that the fluoride causes the pineal gland in children to turn into a stone, like to completely calcify?
I was actually reading the lecture from Jack. Creuset, and he is actually telling that it's not specific fluoride itself, but through the mechanisms of fluoride toxicity, there's increased levels of melatonin, and that's what gets blocked the pineal gland. But the fluoride is actually in there to kickstart, this toxicity process in the
Hmm.
pineal gland.
Hmm.
And the fluoride, one of the things what it does actually, it's really dehydrating the organism. It disturbs the metabolism and circulation of the hydrogen and water in the body. So when he has with his clients working, he definitely looks at the levels of tendons, dryness, and different kind of symptoms which would indicate dehydration of the bodies. And when we know that the aging mainly is really related to the your dehydration levels, because the more you age, the less hydrogen and water you are able to maintain. And if you have ability to address that and reverse that, if you can hydrate through hydrogen breathing machines for hydrogen water, and just being hydrated with the good pure structured water, you will always be able to reverse the aging process, and all your metabolism will be much like a clean engine running much more efficient.
Hmm. Fantastic, thank you. And what would you say to parents who are currently giving their kids fluoride toothpaste or topical fluoride treatments at the dentist?
What would I say?
Yeah.
Study the topic. Don't take my words for it.
Hmm.
In this day and age where the information is so all over the place, there's just there's so many people talking one way or the other way, and it's so confusing for parents and to really educate. But you have to be on this, because otherwise, if you get confused, if there's one guy says one thing and the other professor says another thing, it's very hard to decide who's right and who's wrong. The
Hmm.
more you study the topic, the more you find out there's some questions which these educated people cannot answer. The more you know that there's something
Hmm.
right with the topic, and you need to make a decision on what you want to do. And again, I'm saying the fluoride doesn't solve the problem. If it would solve the problem, the dentist would be out of job, right?
Mm.
You
Well,
know,
can I ask you? I mean, would you give it to your own kids?
no.
No. Okay, fine. And say for people who have given their kids fluoride treatment and topical fluoride treatments at the dentist and fluoride doses every day with a toothpaste, right? What would you say they could do differently, and perhaps to as an alternative, and perhaps to detoxify
Yes.
from it?
So that's what I do. I'm a qualified dentist, and at the same time, I'm specializing in detoxing heavy metals, detoxing fluoride exposure, and detoxing digestion tract and all sorts of. And one of the ways of dealing with the high fluoride in the body content is to detox. Then the question is, what's the best detoxing agents? And a lot of my peers agree, that it's iodine. And funny enough, when I was in America, I found out there's some old pre-World War II ads for dental toothpaste, which were mainly iodine. And iodine is really good because it's an antimicrobial, antiviral, antifungal agent. Our body really uses iodine quite well for endocrine system and more. It's very good antiseptic, and at the same time, it actually pulls out the fluoride. It competes with the in the cell for some receptors, and actually in emergency fluoride exposure, iodine is the number one substance which you need to go. The other thing is, what kind of iodine? There's natural iodine in the seafoods, in the shell foods. I think some people eat the outer shell of the prawns, and the color of the prawns when you get cooked, it gets like type of brownish, reddish type of color, and that's you can see the contents of iodine in it, so you can make it smaller and chew it and eat it. The other thing is that once a week you should eat the seaweed. That's another good source of natural iodine. And again, probably some supplements from kelp to niacin, iodine, and just you need to make sure you have a good dosage. So again, dosage is usually counted by the
Mm.
kilograms. If it's a child, I don't exactly remember now, but you need to make a calculations. What's the dosage best?
Mm-hmm. Fantastic. And actually, also, iodine is in the same group of halogens in the periodic table, so it does compete with the fluoride.
That's right. Competes with the fluoride, but it's not as strong
Mm,
electromagnetically. It doesn't pull, other elements, other electrons from
mm,
the different protein or amino acids, because it has a bigger molecular mass.
mm-hmm,
So it's a little bit still does the function, but it's not as toxic as the fluoride.
mm-hmm. And absolutely, the 1974 Poisons Act lists all the regulations and controlled poisons, which does have fluorides and makes exemptions for fluorides used in toothpaste and in water supply as well. So,
But I don't
uh,
understand why, because all these are strong chemicals.
yeah,
You can call medications, but then again, what's the public use
yeah,
of medications in the public water? So
yeah.
that's
Well, yeah,
the questions.
I agree that no medicine should ever be given to a public without dosage or consent, and that makes it against human rights. That's the purpose of talking about it with you, as well as why we're focused on removing it from water supply. And we have to remember as well that when the water utility company treats 100% of the water, 100% is fluoridated, and much of it, 60% and more, is used in industry and agriculture. The percentage that we use for drinking is so low that you would wonder why you would you know it's just for targeting fluoride delivery. It's a really, really bad way of doing it, and it's not done in any other European country and never has. It's only been America, Republic of Ireland, UK,
There's
etc. Yeah.
another interesting argument by Jack Rousseau when he was saying, that there's a system to check, how well the produces, the foods and fruits can be categorized as organic or not in the special spectrometers to actually check that. So any place which uses fluoridated water, they usually get their levels, the standards, much, much lower than other similar fruits or veggies who've been used in the same conditions but used non-fluoridated water. So there's some companies where they have to decide if the fruit or vegetable is organic or not. They use this laboratory tests to check it. And any organic farmers which been using fluoridated water, they usually don't pass for organic standards.
Mm,
So
yeah.
there's another, kind of a, you can say, controlled study, which indicates that fluoridated water, what it does, it reduces the ORP potential, so oxidant reduction potential in the body, and that's what it makes, the mitochondria and your energy system much weakened in comparison with non-fluoridated water.
Mm, right. Yeah, so it's actually concerning as well. So with the amount of studies you mentioned, there's been lots that concern since to do with IQ and neurological damage.
That's another one.
Harvard 2012, and then four major ones since, the last published in 2019 in the JAMA journal, which is a study of 6 major Canadian cities. They factored in everything, including metabolism of fluoride in the urine and so on. So they did a really large statistical study that showed that it's damaging IQ, and the 4 other studies have corroborated that. But the YouTube NHS video, which was not done, I don't think, at all by the NHS, but by Bison, who's the agency that has created that video and researched and created the video, that's saying that, no, it's safe and effective, and no other studies have shown any damage to IQ. Yet Harvard, 2012, 4 other major ones have shown that. So the fact that they've used Bison to make a video, if you if you search on YouTube for fluoride IQ, you'll see NHS behind the headlines telling you that it's safe and effective despite these studies, and they've not replicated the studies. So
you see, the more you look into this, the more you find out, the different discrepancies and, the different kind of issues. And if you really study the thing, well, from my point, it was kind of a professional thing. I had to study because I'm recommending my clients and patients, they depend on my advice. And if the advice is just, I've learned that at school, my, professors told me, and I'm just repeating the same without thinking. That's one type of, practicing medicine. But when, you learn one thing, you apply the thing what you learn, and, you find out that there's some other possible options, for treatments and, prevention, and apply that, and you see that it's much better outcome from this. So, why not share with your clients and your patients? You're just obliged to, with your ethics and moral to give the best possible advice. And if there's any conflict of interest in other groups, well, that's not my fight to fight. All I do is just, educate the people and just say, do your own homework,
Yeah.
and they're the ones who are ignoring and say, oh, but that study says that it's completely fine and everything is nice and dandy. Well, if it's good for you, go ahead. I'm not able to convince you otherwise. Health, that's your child. You're responsible for that. I can just, give the information as a professional, and what I learned and what I've studied and what I see with my patients, and take my word, or do your own thing. But these days, what happens, there's a war for human brain and the human mind, and the ones who are don't use their mind, they ignorant, and just depend on what the others say. They are losing it, and they're paying with their health. They're paying with their health, and the more I see all these chronic diseases and all these degenerative diseases, these are people who haven't done much prevention, and who just been brainwashed in all these different type of myths, and they haven't done their thinking, and they haven't done the good choices, and they have to pay for the disease.
Yeah, I get the thing is when things like when people are reading in the newspaper about the JAMA publication in August, which came out in the Daily Mail and other newspapers, quite often people will then go on YouTube and they'll look up fluoride IQ and they'll find people talking about it. But then they'll find also the NHS's video, which is like for people who don't have time or the knowledge, they will look at what the NHS say and on their YouTube channel and go, that's the definitive answer. But that didn't even come from the NHS. It came from a marketing, not a marketing, a consulting agency that has probably been commissioned directly by the Department of Health. So anyway, that's these are major problems. There's epidemic problems with children with autism. After combining, when I was a child, we had separate MMR vaccines. They were spaced out over months so that the body had a chance to deal with it. And now they're combined in them. When we were babies, we didn't have any vaccines straight away, but now they have vitamin K. The amount of toxins in aluminium and formaldehyde and other genetically modified organisms is horrendous. Plus, there's evidence that's come out about pharmaceutical companies like Lin Biotech and Merck, who created AIDS virus and the Hep B vaccine and distributed that. And so they're the organizations that are ultimately in control of this big pharma industry. So like, how can anybody trust them who's got a rational mind, you know?
You know, that's what I was saying. You know, there's a war for the, you know, the minds of the, you know, average Joes and, you know, people just who are getting on with their lives. And I'm not really studying this thing. And there's really a lot of, you know, minefields with, you know, fake information and, you know, studies which are done with some interest in mind, studies which is supposed to, you know, give that. For example, the recent study just, you know, days ago, I found out there was a study to prove that, you know, autism is genetical disease.
Mm,
And when I looked at the study, how they did and what they did, already can see some flaws and everything. But, you know, for certain people who don't know these, you know, intrigue details, and they just look at the headline, oh, it's genetic disease, you know, autism, you know, there's nothing to do, can't change DNA, that's what you're born, case closed, you know, there's no discussion on the topic. And unfortunately, you know, everything was related to genetic diseases. What I've noticed with my patients is just it's completely shut down all the discussions, because you can't. Nobody has heard about epigenetics, how your life, life, and, you know, your dietary choices can change your genes as well. That's epigenetics, you know. But if you never heard about it, if you had just, you know, in your mind that genetics is just you got it from your mom and that's it, and you
mm,
can't change it, the discussion is over. There's
mm,
no discussion about the metal toxicities. There's no discussion about aluminum. There's
mm,
no discussion about all, you know, these viruses, you know. And that's what the system is doing, is creating these minefields. So
mm,
the average Joe is started doubting all the information, and it's really difficult for actually for simple people
mm.
to really find out who is who and what is really going on.
Well, for me, it started with a Google search, and it was for holistic dentist, and that's how I found you. But sadly, by then you'd already moved to back to Lithuania, so I missed
Well,
out. But I'm so grateful that anyway we met, because I was looking for a holistic dentist, because the word holistic means they studied the whole body and they understand what they're doing and the toxicity of the mercury and the fluoride and etc. And obviously I knew that that's what you would appreciate and understand. And I think you're right. There's a war going on for people's mind, especially against children as well. There's this war against children, which I find crazy. Like the
that's
situation
right.
that's going on here for their health and their mind as well. So yeah, that's why. Can I just ask you before I forget, what kind of toothpaste or floss or whatever do you use yourself?
At the moment, I'm using non-fluoride aloe vera. I think
Mhm,
you can get it in Hollands and Barrett and Whole
mhm.
Foods as well.
Yeah, yeah, yeah,
I like the texture.
yeah.
Also, I make my own toothpaste with iodine,
Mm,
and I gave it to some patients of mine,
mhm,
some essential oils, but that's another one which I really like
mm.
it.
Because like I mean, because the fluoride kills bacteria and it's a halogen, so it brings the calcium stuff in the bone. But we know, like, if I broke my finger, you would put iodine on it to bring the strength back in the bone, not fluoride, right?
That's right.
But say xylitol for the bacteria in toothpaste, is that still okay to use xylitol? Because aloe vera one, no fluoride, uses xylitol instead of fluoride as the kind of bacteria killing agent.
Well, that's why I use my own making fluoride occasionally, because I kind of a mix and match.
Yeah.
But yeah, some of them they are better, some of them they're worse.
Mm. I mean,
Um,
do you need the does the toothpaste have to include something that kills bacteria or not?
Not necessarily.
No.
For me, the best, you know, home recipe you could do is, you know, coconut oil,
Hmm.
baking soda, dolomites, and iodine.
Mm.
So mix up this, in a little jar.
Oh, could you add something like turmeric and black pepper in there to do the bacteria, or
Um,
not really?
yeah, you could. I mean,
Or
when you know
drink?
the ingredients, and you're comfortable with them,
Mm.
there's no problem with that. It's just the taste
Because
levels.
I'm just thinking about whether turmeric tea or just putting a bit of salt in there is good enough to just kill bacteria. That's the in the cavity.
Another thing, of baking soda and salt is to change the pH,
Hmm.
because again, the mouth, what it does, it creates the movements of the saliva and the inner teeth tissue to flow one direction or the other, and that's how you lose the minerals or you gain the minerals. So there's a demineralization and remineralization going on,
Hmm.
and that's the pH what it does. So, and I think that's the more important, for prevention and prophylactic. So your mouth saliva pH is always, up neutral or a little bit alkaline. So you don't want to for a lot of time periods to leave it, pH acidic,
Mm.
because that's where start losing, the fluids in the tooth and losing the minerals to the outside the saliva.
Mm. And
Just like
yeah, what about because I did it a couple of times. I used a bit of vitamin C on my toothbrush and just brush my teeth with vitamin C. And
mhm.
is that that seemed to whiten my teeth really well. But I kind of got the idea that it might be a good thing, like once every couple of months to do that. I mean, what's your
Was
view
it
on that?
ascorbic acid or was it ascorbate? Because if
As,
it's
yeah,
acidic, it could just bleached, not bleach, but it could have just acids.
yeah, it
They
makes hypochlorous acid, I think, the reaction
yes.
anyway.
So
And
so they
but then
mm,
the initial reaction, it felt very alkaline in my mouth afterwards. So I'm just wondering if
okay.
it's a good, because that will provoke, I guess, that response anyway there, or if it was using lemon juice or something acidic like that, or
Yes, if you're doing at home, try to be careful with the dosage and the products you're using, because
mhm,
I don't. I haven't seen a lot of people who were experimenting with vitamin C. There was a lot of with the bicarb soda, with the coconut oil, still getting very good results. Oil pulling
mhm,
as well, really good results.
mm,
Vitamin C usually we use a lot when we work with the periodontitis, so gum inflammation, gum bleeding, but we usually use it systemically as a
mm,
supplement, as an oral supplement and
right.
pills, and
Mhm.
that's quite important as well.
Yeah. Hmm. Okay. Yeah, because I've got some vitamin. We use vitamin C in one of our products, so I was using that to test,
Okay,
just on the teeth as a toothbrush. But yeah,
so
I'm kind
keep
of, I'm.
Mark, keep testing,
Yeah, yeah,
and then
yeah.
we'll get the results.
Well, I'm doing everything like now, myself and my partner, we're not using any shampoos or these conditioners and stuff. We're making our own stuff now, and we're using the same toothpaste, the aloe vera fluoride-free toothpaste. But now we're looking at just making our own toothpaste as well, just for home. I mean, you can just simply make really simple toothpaste. I
Easy.
think coconut oil, some salt, can be some like all the ingredients you said.
Add the iodine.
Iodine drop, yeah, iodine, and yeah, I think that's great. So like, these are the options people. I think it can save them money. It can be healthier for them, and they have to educate themselves and their children as well if they want to. But yeah, that's really great, like to share these things as a dentist. The first dentist I've spoken to, my own dentist, who I found on the you sent me a link to a website where you could find a registered dentist who does the safe mercury extraction
Hmm.
process, where they put rubber dams on your mouth. They got the air
That's right.
filter. They got all the whole process. They got a breather on your nose. Everything. When they drill the mercury out your mouth, they it atomizes into vapor, and then they inhale this, and
Paper.
the patient obviously gets the toxicity as well. So any dentists, like Bupa dentists, even, they're drilling the mercury out in people's mouths. Can you comment on why some dentists are doing the safe way and some are not, and what the difference is?
Well, it's just probably not educated, and they probably at some point, you know, ignorant. The way I was doing, like you were explaining, with all the masks and all the, you know, irrigation and all the air circulation and everything, that's we're doing. And also, to say the least, I'm doing twice a year heavy metal detox programs myself. So, you know, I'm going through, you know, all this complex 1 month, you know, detox of heavy metals. And I really need that because I just been exposed for so much, you know, toxicity. Even though I wear mask, professional mask, you know, to so whatever, you know, there's a vapor going on.
On your
Uh,
skin, yeah.
yeah, all the skin, you know, is kind of all covered with the paper and you know all these
Mm,
what do you call it?
mm.
Anyway, so I do all the precaution levels, and I still detox twice a year. And the other guys who don't do that don't know what they are dealing with. You know, it's like all these guys who deal with the gold and mercury in the mines. They just don't know better.
Yeah, but what
And
about one dentist I was talking to about this? He said, "Oh, it's okay because we get blood tests once every couple of months or something, and they." But then I thought to myself, would the if you were getting exposure to mercury, your blood would carry that around the body and it would end up somewhere, and then by the time you have a blood test, would that even show any accumulation of mercury?
that's the thing, you know, there's a difficult to really diagnose the mercury toxicity unless you really load it. But in order to correctly diagnose mercury toxicity, you need three elements. You need blood, you need urine, and you need a hair sample. Usually you cut it a hair sample.
Mm,
Only with these three, then, because there's two other meanings, you know, how well you absorb the mercury and how you excrete the mercury.
mm.
One thing that you don't excrete the mercury doesn't mean that you don't absorb it and collect it. That's it becomes even more toxic in you.
Interesting. So that means if they're only doing blood tests, but they're not doing urine and hair, they could be,
Absorbing,
yeah, well, they could be, the dentist could think they're okay, but they're not.
and all
Yeah.
the absorbed mercury usually goes mainly to liver and kidneys.
Mm,
Until you know you work, and at some point when you're 45, you get a kidney failure, or you just diagnosed with some autoimmune disease, and you know a lot of dentists they are very work in a stressful environment, so uh, pollution, the stress levels really makes a toll to the health. And if you would see, you know, a lot of dentists, they're not the most healthiest people.
oh my God, Marius, I can tell you, like as a company, we do a dental reverse osmosis system, which is for the decon room for autoclaves. So we deal with hundreds and hundreds of dental surgeries and even supply bupa and this kind of thing. And we've had dentists going crazy on the phone trying to, shout at us and things like that because they're trying to do a job where they should be getting a plumber to do this kind of thing, and they're having some kind of violent breakdown. And it's like, yeah, I can see like very strange difference in consciousness in the dentist community. Like only very few people have looked into this like at the depth you have. Is commendable as a doctor and a dentist that you've done this on behalf of your clients for the truth as well. And that's what we've been doing, like to uh, I don't think we've not found any necessity for fluoride in any dosage, in any nutritional way for the body in any sense. I've been looking for it. It's like, what good is it for anyone? It's not, and it is in nature. The mother's breast milk is naturally protecting the baby from the fluoride.
That's right.
So, like,
And if you
yeah,
talk about the consciousness, I have another parallel, you know, the more you are intoxicated, the more toxic you are. Doesn't matter, you know, fluoride or mercury or, you know, just food additives, the less consciousness you have. And that's, you know, really just walk down the street and just look at, you know, the people who eat, you know, different foods and
McDonald's.
the way they look and the way they behave. If you just spend, you know, a few hours and observing all this thing, there's no question about it, right?
Mm,
And you know, being the dentist, you know, the more toxic, working in a toxic environment, really, doesn't allow their consciousness to flourish and to open up. And that's, the vicious circle where you're always closed up, you're always under pressure, there's always, more pollution going on, and you just kind of work, 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 work. And I don't know, the
Mm.
end is not really nice.
Mm. Yeah, you see this pervasive here, and this like, well, people just this Google search for holistic dentist didn't come up with very many results. But I tell you now, there's the demand is higher than ever for good dentists out there.
There's some good dentists out there, but there's just, a handful. And
Can you
well,
sorry, can you just remind everyone this website where you can find the safe mercury extraction type of dentist? I would hazard a guess that most of those would be aware of toxicity of mercury, so they would also be aware of toxicity of fluoride. So, what is the website that you can use to find this kind of dentist?
if I believe it correctly, it's IAOTM,
Yeah,
International, International. I always get mixed up. So maybe make a link, under the video.
yeah. I'll do a link for the video. Like, so it's a website where you can search for this kind of dentist. That's where I found my.
So at least they have a basic standard of,
Mhm,
safe mercury removal, safe understanding of how to deal with the
mhm,
fluoride,
mhm,
and at least they have some basic standards, because there's as well as some holistic dentists which
mhm,
they, I would call it, pretend maybe they in the beginning of their searches, and they don't know a lot about different things, but they're trying. But
mhm,
one thing, if 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 you really need for some professional help and you're really in a bad shape, try to find someone who's really on this, quite
mhm,
from the beginning. Because there's a lot of patients who come to see me. Oh, I've been to some holistic dentist, and they just had removed the mercury without any of the masks or anything, and
mhm,
they've been ill for 6 months, for half a year, with all the cramps and digestion system problems. And I really, when they came to see me, I really felt they are scared to do it again. So they really picked us. I was working in the Harley Street in NDU clinic, and they really picked us just because they got some problems with the other dentist.
mhm.
You
You know,
know,
my dentist, she knows that she would get ostracized by other dentists and lose her license if she was publicly saying to people, "Don't do this." She does it quietly. Even when she sent me to the dental hygienist, she goes, "Oh, listen, don't worry about it. She's going to recommend fluoride and all this stuff. Just ignore it." And then, like, but I wanted to interview her and talk to her, and she was kind of umming and ahhing about doing it. But like, there's other dentist lady, I think her name is Rachel Hall, who was practicing dentist in the UK, who did do something, and then something happened. Now she's practicing in Australia. But like, I just feel like for other dentists coming out. I mean, the British Dental Association is the body that's pushing the agenda of the water fluoridation. So the water fluoridation agenda is just evil. So the people in control of the industry are just backed by this kind of entity. So it's very difficult for dentists who are governed by this entity to be able to do it. They're doing it on the quiet. And I think you can find that kind of dentist through at least looking for ones that do the safe mercury extraction.
once you were saying about
Yeah.
these different authorities, I believe there was one video online where this one young dentist was asking, I'm not sure if it was an NHS or BDA, about is mercury bad for health. And you could see this official, he was flipping and flopping, and he couldn't give it. It's all on video, and it's official figure of dental body. And when you look at that, really you raise these questions, what the hell is going on? If you can't get a straight answer, just yes or no.
Mm.
So I don't know if you've seen that video, but definitely recommend to watch it.
Yeah, I mean, I've seen enough for myself to know that the thing. I went for a dentist. I mean, she charges £250 to do a filling instead of what people would pay in a dentist that didn't do it safely. They'd pay £90. So really, you get what you pay for when it comes to dentistry. I think when you go to a better dentist, I think you do get what you pay for. The ones that do it safely are doing a lot of procedure and setup to make sure it's done safely, and that's
You
the
know, if
yeah.
if you know the system would allow difference of opinions, and there wasn't this ostracism and all this taboo about speaking about different topics, there would be more holistic dentists. Would be bigger competition, less of the prices. So
Mm,
all it's not the dentists who are charging a lot. It's just the system who is crushing the competition and doesn't allow to get more of those dentists. So
mm.
the losers are the patients again.
Well, I think that at one point in time, I don't know if it's true now, but dentists were getting paid per filling, per mercury filling they were administering. So you had a lot of scandal with people like me, who was a 13-year-old, 12-year-old child, something like that, that walked away with 13 fillings after general anesthetic.
Yeah,
This kind of
that
thing
was
happened.
quite a common thing.
Yeah, yeah. So that was me. So that's how I discovered for myself how bad it can be. Can I ask one other question as well that might be interesting for people to do with the teeth and about when you've got the option to either extract or you have a root canal, and the whole thing about how teeth are linked to the other parts of the body and what can happen, because I'm just wondering about that for myself, because sometimes it seems like a double-edged sword. Do you get root canal or do you have an extraction? Both have this negative consequence. If you can just open that mystery up for me, I'll be
Yes, I have written an article about that on my website, just my name and mariusambraziunas.com. And in that article, actually, I lay my grounds for every case is individual. And once you really go for extractions or root canals, you really have to know what's the situation. I usually had two categories where I was had a different outcomes depending on on which category the patient lies in. So let's suppose you are a 13 years old kid and you just had a bike accident, or just fell over or something, and you knocked your tooth, and it's the nerve is exposed. What do you do? Do you get extraction and have a denture from the age of 13, or do you just have a root canal and you have a cap or a crown, and you get your for your adulthood, and then you decide what you do later. Or another category is, you are older person, you have chronic diseases, you have diabetes possibly, and your doctors are writing you letters about cancer screening, about the risk of getting cancer. If that patient comes and there's a question about to do root canal or extraction, there's no doubt always extraction, right?
Mhm.
What's the difference between those two categories of patients? One being, a young kid, possibly it's not intoxicated and has a lot of, resources to maintain good health, and allowing the metabolism and different systems work in order. The other category, the elder people, they are risk of systemic chronic autoimmune diseases. And the root canals, what they do, they burden your immune system, so it cannot fight those diseases. And if there's a risk about heart attack or the cancer, you don't want to play with those risks. And it's better to have the tooth removed, and you have a better chance with your immune system to solve the ongoing chronic issues. That's one thing. And once you are a kid, you don't want to have a denture when you're 13. Have you had a denture?
No, I've had like 4 extractions.
Yeah, but no
And I've
dentures.
no, I've got sorry, 3 extractions, and I've got 3 root canals.
Okay. So
So I got worried about whether my root canals had been infected or any pathology around those sites, around the cavitations, as well as the root canals. So
okay, now the other thing once you have is, how does that affecting, and do you have any symptoms of, different systems related to that particular tooth that it affects, those systems. So in Chinese medicine, there's meridian system, there's 12 meridians, and they all connected through the teeth. And the teeth, they are like, electric switch board, what do you call it? Switch, yeah,
switches.
switches. And once you have the nerve removed or the tooth extracted, there's no more circulation going on as it used to be. It doesn't mean that it completely shut down, but you're losing the strength of energy to that system and to that organ. So, for example, the number 3 teeth, the canines, they all related to the liver and the gallbladder. And if you have decay on the tooth, or if you have a root canal, we definitely know that your gallbladder and liver, they're in poor shape. And once you've had a root canal, the situation even gets worse, because the energy delivered through meridians is not circulating as well as it used to be before the canal been removed. Another case, I had that a middle-aged guy, well, 60, and I saw the X-rays, and he had 2 teeth root canal. This is number 2 and 2 on the lower jaw. And my first question was, how are your prostate issues? And he just looked at me and says, oh, I'm going and see my, GP doctor for, more tests on my prostate and everything. Because I know all this is, kidneys and prostate. And if there's, canals done, that means, again, the function of the organ, ability to detoxify and maintain the function is already diminished, and it's a risk situation. So once you get starting, the symptoms that your systems don't work, first of all, what I usually recommend is you need to try to boost those systems through acupuncture, through detoxing, and through actually a different system of actually boosting the function of that organ. Could be the diet, it could be supplementation, could be hydrogen therapy, all that sorts. Once that's done and you didn't see any improvement, only then I would recommend to go and see dentist and see, is any infection over there, is there, cavitation.
Mm.
We should do with the invasive procedures like extraction or, episectomies, to actually eliminate the source of infection, the source of, immune depression in that area. And once you find out that yes, there is some infection, there's some problems specifically related to that tooth and to that organ system, and if you cannot fix it non-invasiveness way, you actually decide on further ways of actually extracting the tooth and possibly restoring with the implants or other ways like bridges and so on.
Mhm.
But in this argument about extraction of root canals, they always the question is, what do you do after you extract the tooth?
Mhm.
Because I had few cases where people had 6 root canals, and they, like 2 and 2 on the lower molars, and they got their one advice from the dentist, to take them all out, which they charged a very nice sum of money, and they did quickly extract it, but there was no plan on what they're gonna do next, and the person didn't have enough money to go for implantation and everything. And what happened that the woman got in the situation that she had some systemic situation. She had the teeth extracted, but because they were not looking holistically, they were just looking at, okay, I see this, from dental point of view, I see this little problem. I took the problem away, but the woman left with no teeth, same problems, and still had to plan how to save money for implants, you know?
Mm.
So I'm quite passionate about what I do, and I'm quite passionate about, other people, so they really fully understand what they're doing. And when they jump on this wagon about extracting the teeth with the root canals, they need to know that there should be a plan B, right? Maybe you should be once the tooth, then you have an implant, or you should maybe save a little bit longer and do all in one go. But if once you start removing the teeth, what happens? The other teeth start moving in their place. So your bite, your jaw alignment start changing. And just imagine if you don't have any back teeth, four molars at the back, what's going to happen? And if you leave it for more than 2-3 years, it will be much more difficult to restore the implants.
Mm.
So there's a different kind of situations where you need to model. And for me, the best is to actually explain and educate people, and tell them ABC what's going to be after this and that, and you have to be prepared for this and that. And the least invasive procedures usually I do first, and then I just go deeper and deeper with more invasive procedures like prevention, root canals, extraction. But the root canals, they're not perfect. Nobody got it better, but in some cases, they're not the worst evil, or more like temporary measures. Like I said, that case with the 13 years old kid.
What about, like, say, someone who's had a root canal for 20 years, and what do you advise that they do? Is it just kind of regular checkups is enough, or should they go for like a 3D scan or this kind of thing?
If you're worried about this, yes, 3D scan is one of the best one. I just recently had, even though I work in Lithuania, but I get some 3D scans sent to me over the internet. And I saw, one woman send me the 3D scans, and she had chronic sinusitis.
Mm.
She had 2 operations on the sinuses and the nose membrane change and everything. And she already saw 2 guys, who the surgeon and her dentist, and they didn't saw anything. I looked at the 3D scans, and just like, here's the problem, here's the problem.
Mm.
And I can see the cyst and everything, and she had this for 5 years, every 2 weeks. That's a
Mm.
big symptom, and these root canals have been there for all that time.
Mm. So if it does flare up, the symptoms should be quite obvious as well for most
Yes,
people. Yeah, yeah.
so you need to have extraction.
Mm.
There's no
Yeah.
question about it.
Yeah, yeah. I mean, the thing is, I'm trying to teach my kids who are 5 and 4, sorry, 6 and 5 now. Oops. I'm trying to teach them so much the importance of the teeth and everything, and they're learning really well. And I don't have to get them to brush their teeth and all this kind of stuff. So,
Well,
yeah.
talking about the kids, I could say that once I was working in the NGU clinic, one of my specialties was working with the kids, and my job was tell the parents what to do so their kids didn't have a tooth decay,
Mm.
right? That's where I used to do my diagnostics, that's what I used to do my bioresonance. I was checking, the inflammation in the bowel. I was checking inflammation in the small intestine. I was checking if there's any parasites over there. I was checking if there's any mineral and vitamin deficiencies. And once you have all that big picture, you can see, okay, For example, there's all B group vitamins missing. Okay, there's a parasitic in flora in the large intestine, right? So they need to go for antiparasitic medicine or supplements, get this colon nice and clean, so there's no inflammation, so the person can absorb all the nutrients. Plus, make a diet plan, what these kids should eat, and what different kind of vitamins should be to absorb the different minerals. So there's a very good book about, gosh, I forgot, about how to look after the teeth. Uh, I'll remember later, but that's very important, especially before they get sign. That's where the growth spur occurs. That's where they're growing the more.
Did you say 7? Sorry.
Starting from 7, because at
7,
the
yeah.
age of 8, they becoming they start growing much more. And what happens is that if they're deficient in nutrients, but their DNA program information is running as it should be, there's no delay. And if they're deficient, all the structures become weak, right? So they don't get filled because there's no nutritional dense foods. I'm talking about average, kids.
Mm-hmm.
And if there's no dense nutrition foods in there, of course, the teeth, they just can be like a shells of eggshells, and so much easier to get decayed. But once you start building, from the age of 4 to 8, that gap, with some minerals, fat oils, fat soluble vitamins A, D, K, and E, all that stuff. That's where you're actually making the solid grounds for prevention of tooth decay. And we don't even talk about fluoride, because all the bones and teeth, they are mainly made of minerals.
Mm-hmm. Well, I mean, there's so much that's it's a terrible thing going on. There's this sort of targeted thing against for fluoride, and in dentistry. Dentistry is so important to the overall health of the body, and you've just given us insight into that, which is really valuable for everyone to listen to this. And just the things that you're talking about, nutrition. The high street is full of the fast food and McDonald's, and even then, even there's evidence there's actual human remains in McDonald's, and Pizzagate scandal, all this, thousands of children going missing every year, and this is Haute de la Baran and cases like that in Jersey, in the UK. There's Satanists controlling this kind of thing going on. And the fluoride agenda, this kind of thing, is a Satanist agenda. It links back
That's
all
right.
to that. It does link back all to that. So ultimately, if you buy it, that's what you get. You get this misery because it profits on your misery and your death and destruction.
If the government really wanted to solve the problem, it would start it solving, not just with the dentist, but with their nutrition, with their food, and controlling, all the preservative and all the other
Mm.
things. Because without the proper food, you can be play, putting plasters on all these little problems,
Mm.
but still they're just gonna keep running and repeating itself.
Absolutely. That's why, this year coming season, growing season, I'm going to be putting out all the information about when to do seeds, the moon cycle, and all this stuff, how to compost your soil, how to grow. It's so important to just produce as
I'm
much.
still waiting for that calendar from your wife.
Yeah, we have this. We have a grow calendar. So we're now planning when to put the seeds down according to this calendar, because it's proven that they absorb more moisture at this time and they come out better, this kind of thing.
Today is a
But
young moon. I already put some seeds in the soil.
yeah. So we're doing this. We're trying to do it on this kind of Steiner principle, Rudolf Steiner.
Okay, yeah, I know.
Yeah, this kind of thing. So and the way you treat the soil to get good nutrition in the food. This kind of food that's got the good nutrition is grown with love. And
That's the
everywhere you can,
basics.
yeah. And if you can only buy food for money, unless if you go to another Google search that everyone can do, instead of as well as holistic dentists, they can look up biodynamic farm.
Hmm.
So there's places where you can go. They're normally run by volunteers and charities. They really grow food for the love, and they don't use any bad fertilizer or pesticide or anything like this. So you can actually eat food where there's holes in it, where the worm is eating the potato, and you can just cut that bit out and eat it.
The
Uh,
best way of checking if the food is really dense is a smell. I
mm,
don't know if you've been to some holidays in Spain or Turkey, where the fruits, they smell differently over there. Same tomatoes, same cucumber.
mhm,
When you smell it, and that's usually you smell all the different microelements and nutrients of that soil. If the tomato is just empty, plasticky, and no smell, most of this is grown on hydroponics
mm,
and just some three major elements as given to this to the water content. But the real soil, that's what's rich in microelements. And that's
mm,
where the smell comes into. If you smell something, that means it's much better content. Plus
mm.
other tests you can do.
Yeah, like a lot of people say, oh, that growing your own food or making your own toothpaste or all this kind of stuff is like a lot of people go they can't do it because of their job or where they live, or they live in a flat in London or this kind of thing. But that's a choice then. So if you to do it, you need to leave that environment and go to a place where you can do it, right?
Well, another thing, what I would say, some people definitely can't do it because of their lifestyle in the city, but also what they could do, they could support those people who can do it and support local businesses. And they could support, local craftsmen or, local economy. And there are some conscious people who are trying to do their share bit, and there are some places where you can get like biodynamic farms and
Hmm.
other organic foods and markets, so you can support that. You don't need to buy all this high
Hmm.
street groceries, everything.
Yeah, I mean, I'm just careful what we're putting into our beds, which we get from the compost in the forest, and we get compost from the forest to put in our beds. So there's nothing, no chemical or anything bad on this.
Make
Uh,
sure your water is not fluorinated.
yeah, well, we do obviously, we obviously purify the water to the most acceptable level we can. This is for the garden as well. So yeah, as well as what we have contact with. Yeah. But this has been really, this talk we've had and the information you're giving us is really, really good for people to know this. And it's really for them to discover for themselves and then make their own choices now. That's what I wanted to do is like get it from a dentist who knows what he's talking about. So thank you for sharing everything.
Yeah, there's a lot of topics we could cover, but again, we have to be careful and not
Mm,
really going too crazy into conspiracies or anything. There's also different studies and lectures which looks on these topics, more deeper. But my message, to your listeners and people who are related to want to know more about dentistry and less toxicity in dentistry, you need to study this topic because your high street dentist, he's in such an environment that he has no luxury to really look around and talk about these things because of regulations and licensing issues and everything, and you're just living one on one with your health and you. And if you really want to be healthy, you need to really look into nutrition, good foods and diets and detoxification techniques. You have
mm,
to do it regularly. So my clinic, I do all the detoxification. Once they ask, how often should I do? Should be, twice a year. Springtime and autumn time. You should do something for your body, either some supplements or detoxification or antiparasitic supplementation. Because once you do it regularly and you have a good rhythm, it's the same with the religion. I don't know if you're religious
Like,
or
oh,
not.
fasting, kind of fasting as well.
That's right.
Mm.
It's, they have these fasting regulation before Easter and before Christmas, right?
Mm.
So it's for a reason. So if you do it, at least twice a year, fasting, supplementation, detoxing, you're always gonna have your health much better than the others who don't.
Mm. Yeah, I think so. I kind of got out of, I was a fluoridated Mercury child, and I kind of into my middle late 20s. That's when I started realizing that's not good, So, and I studied fluoride for so long that I can say that it is a conspiracy, and it's not nice, and it's not like, in terms of religion, it's either light or dark, or it's good or bad. Whatever religion or God or whatever you believe in, it's either good or bad. The fluoride agenda is bad. It's a cover up, and it's bad. And thanks for talking about it. And so hope many parents listen and and take it on board. And some of the stuff you said about meridians and how it's all connected, it shows you how important dentistry is, yet how in the dark it is. And thank you
That's right.
for bringing it into the light or the good, So,
Well, of course, we have much more to say, but
mm,
there's other topics and other situations. But just for the beginning, for people who are got interested about dental health, they should know that the fluoride is not the ultimate mineral which you need to rely on. It's all holistic approach of system working, absorption, minerals, nutrients, vitamins. That's what makes your dental health
it just, I mean,
stronger.
is there any nutritional requirement for fluoride at all that you know about?
No,
No. Yeah. Okay. Thanks very much. That's answered everything I really wanted to ask you. In great. Thank you so much. It's really good to speak to you, and I will speak to you again soon about hydrogen because I want to know like how it's going with the treatment you're doing there in your clinic.
sure,
Yeah.
sure. We'll
Awesome. Thank you so
continue.
much. Okay,
Okay,
Maris. Thank you so
take
much, mate.
care. Bye.
Cheers. Take care. Bye.